Dr. Scordi-Bello, this Attorney Brennan just asked you questions about alcohol consumption. You had the opportunity to evaluate the medical records of Mr. O'Keefe, correct?
Correct.
And you had, in terms of the medical records, information with regard to the medications that Mr. O'Keefe had taken, is that correct?
I believe I reviewed those records at some point prior to issuing my report, yes.
Do you recall the list of medications that were in the medical records that Mr. O'Keefe was on?
I do not recall.
If I were to show you a document, might that refresh your recollection as to the list of medications?
I'm going to allow it. Is in connection with alcohol too, you said, right?
Correct, Your
Go right
Honor.
ahead. Yes.
Dr. May I?
Yes.
Dr. Scordi-Bello, may I stand by the witness?
Yes.
Dr. Scordi-Bello, I am providing you with a document. Up at the top it says John O'Keefe, and I would like to draw your attention to medications. And to expedite it, I am going to focus on the fourth item on that list. Can you state what that medication is?
The fourth item is omeprazole.
Does that refresh your recollection as to one of the medications Mr. O'Keefe was on?
Yes.
And that medication is?
It's an antacid.
Right. And so omeprazole is the trade name of omeprazole Pepsid?
I believe so.
And Pepsid is a proton pump inhibitor?
Correct.
And a proton pump inhibitor stops the proton pump in the stomach from releasing acid, correct?
Yes.
And we're going to come back to that in just a moment, but do you also recall testifying at the grand jury with regard to alcohol consumption and potential alcohol consumption of Mr. O'Keefe?
I do remember testifying, yes.
And do you recall what your testimony was with regard to alcohol consumption and small ulcers in the stomach potentially associated with alcohol consumption?
Alcohol consumption, I don't recall my exact words at grand jury, but alcohol consumption can lead to gastric ulcers.
And alcohol consumption can lead to gastric ulcers, and what medications can treat gastric ulcers?
Well, they don't treat them, they prevent them, but that would be a proton pump inhibitor such as omeprazole.
Right. So, isn't it correct, therefore, that the ulcers that are observed in the stomach of Mr. O'Keefe that we talked about, the gastric mucosa, could have come from ulceration due to alcohol consumption,
It's possible.
as opposed to hypothermia, correct?
Correct.
Attorney Brennan asked you questions moments ago, and actually several of them, of which included the words, did I hit him, could I hit him? Do you recall those questions?
I do.
And isn't it correct that you had that information before you issued your final findings in this matter in April of 2022?
Yes, I did.
So, even though you had all that information, you still were unable to conclude the manner of death of Mr. O'Keefe, correct?
Correct.
Thank you, Dr. Scordi-Bello.